Hello, everyone, and welcome to our question lab. We're happy to have you here. This evening, we will be discussing bacteriology. We appreciate you guys being here as always. As you guys know, we do this every Tuesday at 6 p.m. and we're lucky to have with us today Dr. Paras Vicaria, who will be leading today's dissection. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident at UT Southwestern in Dallas, Texas. Originally graduated from pharmacy school and then went back home to Michigan to do med school. I've worked with RX specifically as an RX coach for about a year now, primarily working one-on-one with students in regards to tutoring for the USMLE Step 1.
Excellent, thank you, Paras. And if you guys look at your GoToWebinar control panel, you will see a question box, and you can enter your questions there, and our panelists will do their best to answer those questions for you. We have some wonderful panelists with us. We have Kate and Jeff, who you'll meet later, as well as one of our other RX coaches, Mark. Mark, do you want to introduce yourself?
Hello, everyone. My name is Mark Hesslin. I'm a fourth-year medical student at Cooper Med School in Camden, New Jersey. I've been working with RX Coach for about 7-8 months now, mainly with students for Step 1 and Step 2 CK. I'm happy to answer any of your questions.
Excellent. Thank you so much, Mark. And my name is Sean. I've been with RX Coach for going on almost 2 years now. RX Coach is our new one-on-one tutoring program, and we'll talk about that a little bit more later this evening. For those of you who are wondering, next week we'll be covering cardiac pharmacology. So next week, Tuesday at 6 p.m., we will be covering cardiac pharmacology. So we hope you guys can join us then. As always, we do have a raffle this evening. We do have a very special offer for you this evening. So please stick around until the very end. All right. You've had a chance to meet us, so we would like to get a chance to now meet you. So I'm going to ask you guys a question. You should see a poll pop up on your screen here shortly. And we'd like to know, who are you? I'd like you to take a couple of seconds to respond and let us know. We'll give you guys a few seconds here. For those of you joining us for the first time, this is the same exact poll type of format you will see with all 4 of our questions this evening on bacteriology. So you will have a chance to input your responses and select the correct answer. So please take a second now to answer your question, become familiarized with this poll. All right, looks like a lot of you guys have voted. Let's check and see who is with us today. We have a lot of international medical students and US and Canadian born international medical students and graduates. We want to welcome everybody here. We have a lot of MD US Canadian medical students as well, and we're happy to have all of you here, and we hope that this session today is helpful and you guys learn a lot from it. We know that a lot of you guys are studying for Step 1, and so we'd like to know, when do you plan on taking the big exam? So please take a second and let us know, when do you plan on taking Step 1? We'll give you guys a few more seconds to respond, and then we will kick it off with our first question of the evening on bacteriology. I see the responses are coming in, but a little bit slowly, so we'll give you guys a few more seconds here to respond. All right, I see the responses are coming in. Let's go ahead and take a look. And it looks like we have a lot of people taking it between now and the end of the year, early next year, and even beyond. So we're happy to have all of you here. For those of you taking your exam soon, you'll learn a lot about RX Coach today, and hopefully you'll find tonight's session helpful. And if you really like what you're hearing and you want some additional assistance, we do have wonderful RX coaches like Boris and Mark here to help you reach your peak potential on test day. So with that being said, we're going to go ahead and start with our first question of the evening. Now, I know I've mentioned RX Coach, and we'll talk about that later, but the methodology we're going to use today is the same methodology that we use in RX Coach. And the first step in that methodology is to cover up the answer choices. And the reason we do that is because we do not want the answer choices to guide your thought process or to dictate your thinking. We also don't want you guys to see an answer choice you're unfamiliar with, and that may cause you to panic as you're trying to read and answer this question correctly. So for tonight's purposes, I've gone ahead and removed those answer choices for you. And once we cover up those answer choices, what we'll do is read the lead-in or the last sentence. So let's do that now. Gram stain of the CSF would most likely reveal which of the following? Gram stain of the CSF would most likely reveal which of the following? And after we do that, we like to ask our students how many steps they think this question will require. And the reason we do that is because it's important to keep an organized thought process, to make sure we're not missing any steps, and to make sure that we're answering the right question and taking a consistent approach every single time to minimize some of those test taking errors. So please let us know in the question box how many steps you think this question will require and what the 2 or 3 most important keywords are in this lead-in. And Paras will talk about those clues as well as how many steps this question requires when we move on to the next slide here. So give you guys a couple seconds to respond here. And while you're doing that, we're going to go ahead and begin reading the vignette, okay? Now, normally in the coaching sessions, we'll stop you after every sentence and ask you what you think is important, what you want to highlight, what's on your list of differentials, to make sure you're picking up on all of the relevant clues, not getting distracted by the distractors, and also have a good thought process so that we can get to the right answer. So here we go. A 3-year-old boy is brought to the pediatric emergency department by his mother. She explains that since yesterday, her son has been burning up and complaining that his head hurts. On examination, his temperature is 103.9 degrees Fahrenheit or 39.9 Celsius. Photophobia and cervical stiffness are noted. Lumbar puncture and cerebrospinal fluid analysis show an increase in polymorphonuclear cells, an increased protein level, and a decreased glucose level. Gram stain of the CSF would most likely reveal which of the following? And with that, I'll turn it over to Dr. Beccaria. Paras.
Thank you, Sean. So what we've done here is we've highlighted what we think are the important clues. So we'll kind of walk through that right now. So first is 3-year-old boy. That is talking about demographic information. That's always important. Other things is that time frame. So this has been going on since yesterday. He's had a fever, he's burning up, his head hurts. They gave us a pretty high temperature there. He also has photophobia, cervical stiffness, and then they also gave us some CSF analysis results, which are going to be helpful in this question. So now we'll go ahead and take a look at that question and talk about how many steps we think this question could be. So I think 1, we need to figure out, what may be going on. 2, we need to figure out with specifically that CSF analysis, what that's getting at. And then, there could be another step or 2 depending on the answer choices and what the question's asking. So maybe a 2-step question, give or take. So now we'll go ahead and look at those answer choices. And what we'll do is we'll start at the bottom and we'll work our way up. So we'll start with answer choice E and work our way up to A. And the reason we like to do this is we like to make sure that students don't bias themselves by starting at the top, seeing something they like, and then going with that answer choice. So this ensures that you get through all of the answer choices. So we'll go ahead and do that. Answer choice E, poor gram staining. D, gram-positive rods. C, gram-positive diplococci. B, gram-negative rods. A, gram-negative diplococci. So we'll give everyone a couple seconds to gather your thoughts. We'll go ahead and open up that poll and then go ahead and select the answer you think is right, and then we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So we'll give you guys a couple of seconds here to select a response that you believe is correct, and then we'll go over the correct and incorrect responses together. As always, remember that when you're doing questions, it's important to go over the correct and incorrect answer choices to make sure that you answered you got it right for the right reason, but you also know why you could, if you missed it, why you missed it, and what you could do to get it right next time. So make sure you always review the correct and incorrect answer choices. We'll give you guys a few more seconds here to respond, and then we'll go over it together. I see the responses coming in. We'll give you guys a few more seconds here. All right. Well, let's see what you guys selected. Looks like at first place with 43% of you guys selecting was answer choice C, gram-positive diplococci. And in second place with 35% of you guys selecting was answer choice A, gram-negative diplococci. So let's go ahead and see what the correct answer is. And the correct answer is C, and 46 to 43, right? So well done. I'm going to turn it over to Paris. Paris.
Thank you, Sean. So we'll go ahead first and look at that question stem. And what we see here is, demographic information was pretty important. This is a 3-year-old child. They also gave us some CSF analysis. So we're talking increased protein, decreased glucose, and importantly, increased PMNs. So that suggests, one, his clinical presentation of fever, photophobia, cervical stiffness, and headache. That suggests meningitis. And then when we talk about the different types of meningitis, that CSF analysis is pointing us towards a bacterial meningitis, like a lot of you guys selected. So now let's go back to that table, and what you'll see here are the most likely causative bacterial pathogens by age group. So our child was a 3-year-old child, so he is going to be in that second column. And you can see there that the most common cause of meningitis is strep pneumoniae in that age group. So this is a very high yield table, knowing what is the most common cause of bacterial meningitis or meningitis in a patient based on their age group. So definitely important to know this. So when we look at the answer choices, knowing that strep pneumoniae is the most common bacterial pathogen in this age group, we know that strep pneumoniae is a gram-positive diplococci. So that would be answer choice C. The other answer choices are incorrect. E suggests something that's non-bacterial, but as we talked about, the CSF analysis points more towards a bacterial meningitis. D, that's referring to something such as listeria, so gram-positive rods. Listeria you would see more commonly in newborns or the elderly, and you would see more monocytes, not necessarily PMNs. C was the correct answer, so we'll move on to D. So gram-negative rods, that could get at something like Haemophilus influenzae, which would have similar CSF findings. However, it's a less common cause of meningitis in this age group, and also keep in mind that the incidence of this type of meningitis has decreased since the introduction of the vaccine. E. coli is another thing that's a gram-negative rod, but that would be, again, in newborns, in a different demographic than our patient. Lastly, A, which was the second highest selected answer, that could be talking about Neisseria meningitidis. Similar CSF findings, however, as we talked about, it's not the most likely source or cause of bacterial meningitis in this age group. If we were talking about adolescents, sure, that could be that is the #1 cause per that table. But in this question, in this demographic, answer choice C, or strep pneumoniae, is a correct answer.
Excellent. Thank you, Paris. Good job, everybody. That was a pretty strong start. Let's go ahead and keep the momentum going with our second question of the evening. Once again, as you guys can see, the answer choices have been removed. That is by design, like I mentioned earlier. Once we cover the answer choices, we will then read that lead-in together. So here we go. Gram staining of urethral discharge is shown in the image. And here's the lead-in. Which of the following describes a component of the most likely causative organism? Which of the following describes a component of the most likely causative organism? So now that we've read the lead-in, I'm going to give you guys a second to respond in the question box and let us know, what do you think are the most important clues in the lead-in, and how many steps do you think this question will require? An example of a one-step question could be, what is a diagnosis? An example of a two-step question could be where they ask you, what is the treatment for a diagnosis? And an example of a 3-step question could be where they ask you, what is the mechanism of action for a treatment, for a diagnosis? So with those examples in mind, please let us know, and then we will go over how many steps it requires in just a moment. I see the responses coming in. Wonderful. So now we will go ahead and read that vignette. A 31-year-old man comes to his physician's office with a report of pain on urination for the past day. The patient also reports yellow-white discharge from the urethra. He is sexually active, occasionally uses condoms, and mentions that he has had 3 sexual partners in the last month. He denies fevers, chills, changes in weight, new rashes, and tingling or numbness in the extremities. The patient's temperature is 37.5 Celsius or 99.5 Fahrenheit. Pulse is 88 per minute, respirations are 14 per minute, and blood pressure is 135/70. Physical examination does not reveal any tender lymph nodes, rashes, or skin lesions. The patient has full range of motion of his joints and normal strength and reflexes in all extremities. Urinalysis reveals color yellow, appearance clear, specific gravity of 1.012, pH of 7, protein negative, glucose negative, ketones negative, bilirubin negative, urobilinogen normal, blood negative, leukocytes negative, nitrite negative, white blood cell 1, RBC 2, bacteria rare, casts 1, hyaline cast. And gram standing of the urethral discharge is shown in the image. I'll give you guys a second to take a look at that image. And now we'll read the lead-in again. Which of the following describes a component of the most likely causative organism? So we'll give you guys a couple of seconds now to respond in the question box. Let us know what you think some of the most important clues and keywords are. I know this is a longer vignette, so I'll give you guys a little bit extra time here to let us know in the question box what you think the most important and relevant clues are in this vignette. We'll give you guys a few seconds to respond, and then we'll have Paris go over those clues with us. Excellent. I see the responses coming in. Give you guys a few more seconds here to think about which clues are the most important in this vignette. All right, I see some good ones coming in. Paris.
Thank you, Sean. So what we'll do is we'll go ahead and take a look at those clues and what we think were important in this question. So again, demographics. What are his signs and symptoms? Excuse me. So pain on urination, yellow-white discharge. And then also they give us some risk factors. So he is sexually active, only occasionally using condoms, has had 3 sexual partners in the last month. And then one of the themes of this question is actually what's negative. So as you'll notice with step 1 questions, and also when you get to clinical rotations, it's not just about what's positive, but it's about what's negative. What are those pertinent negatives that are going to be very important for you to know and find out when you're talking to a patient? So this patient denies fever and chills, denies any rashes, no tender lymph nodes, full range of motion of the joints. As I'm sure things are starting to come into your mind of what that could be ruling out for you, which we'll talk about later. And then also on urinalysis, they told us that leukocytes were negative, nitrites were negative, and there was rare bacteria. So now when we talk about which of the following describes a component of the most likely organism, I think you could argue that this is a 3-step question. So 1, we need to figure out what's going on in this patient. 2, what is the likely causative organism? And then 3, what is a component of that likely causative organism? So now let's go ahead and take a look at those answer choices. And again, we'll start our way at the bottom and work our way up so we don't bias ourselves. E, the ability to metabolize urea into ammonia and carbon dioxide. D, antigenically variable pili. C, an infectious extracellular form and an intracellular form capable of replication. B, a polysaccharide capsule with the ability to ferment maltose. And A, a helical shape with two cell membranes and flagella trapped between them. So once again, we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the correct answer to this question. Remember, this is a three-step question, and then we'll go ahead and talk about it in just a few seconds.
I'll go ahead and read these answer choices again, just because some of them are a little long. So answer choice E, the ability to metabolize urea into ammonia and carbon dioxide. D, antigenically variable pili. C, an infectious extracellular form and an intracellular form capable of replication. B, a polysaccharide capsule with the ability to ferment maltose. And A, a helical shape with two cell membranes and flagella trapped between them. We'll give you guys a few seconds here to respond. I see the responses coming in. Give you guys a few more seconds, and then we'll go over the correct and incorrect answer choices. All right, a few more seconds here. I see the responses are coming in. I know this is a little bit of a longer question, so we'll give you guys a couple of extra seconds here. All right. Well, let's go ahead and see what you guys selected. And it looks like 43% of you guys picked D, antigenically variable pili. And in second place was answer choice C, with 27% of you guys picking an infectious extracellular form and an intracellular form capable of replication. Let's see what the correct answer is. And the correct answer is D, antigenically variable pili. And once again, 43% of you guys got it right. So well done. And with that, I'll hand it off back to Paris. Paris.
Thank you, Sean. So we'll go ahead and look at that question stem first. And this is a man who is sexually active and not using condoms consistently, who presents with urethritis and a purulent discharge. So this is some sort of bacterial infection. And then when we look at the gram stain, what we see there is we see neutrophils. We see multi-lobed cells. You can see those are what we call PMNs. Okay, now within those PMNs, if you can appreciate, there's little diplococci within there, within those neutrophils that are staining a darker color, and that's characteristic of Neisseria gonorrhea. Okay. Now, when we go back and look at that table, and Sean is highlighting there what we were talking about. So we see that this is a gram-negative diplococci, and you can see there in that image as well, those gram-negative diplococci within a multilobulated neutrophil or PMN. Furthermore, it's sexually transmitted, specifically Neisseria gonorrhea or gonococci. When we look at that table, we see some risk factors include the lack of use of condoms, which decrease sexual transmission. And then specifically, we see in that table as well, the very third row, it says that there's no vaccine due to antigenic variation of pilus proteins. So this is one of the reasons why you can't, there's no vaccination. It's one of the ways that this organism evades the immune system. Furthermore, it's one of those gifts that keep on giving, how you can get repeated infections with this. So in that situation, answer choice D, antigenically variable pili is a correct answer. So we'll take a look at those other answer choices on the next slide, and we'll take a look at why those are the incorrect answer choices. So E, the ability to metabolize urea into ammonium and carbon dioxide. This is characteristic of Ureaplasma ureolytica. This causes non-gonococcal urethritis and does not stain on gram stain. So that would be an incorrect answer choice given that image and the other things that we found out. C, this is getting at the elementary and reticular bodies of Chlamydia trachomatis, so a chlamydial infection. So this is an obligate intracellular bacteria that can also cause urethritis, but it also does not gram stain, which is not consistent with that image that we're seeing. However, keep in mind that chlamydia infection can often be found in association with gonococcal urethritis. B, this is getting at Neisseria meningititis. So this has a polysaccharide capsule and can ferment maltose, but it's not associated with urethritis. This is Neisseria meningititis. This is getting more at meningitis, obviously. So that would be an incorrect answer as well. And then A, this is characteristic of Treponema pallidum or syphilis, which usually presents with a painless chancre. You can, in secondary syphilis, have a rash. And then this would be visualized with dark field microscopy, and these do not gram stain as well. So another reason why that's incorrect. So it's important to keep in mind how many steps your question is, and then try to make sure that you're capturing into your memory bank a lot of these visual recognition things about what a gram-negative diplococci would look like within a neutrophil.
Excellent. Thank you, Paris, and great job, everybody. So I know we talked briefly about RX Coach. I want to tell you a little bit more about it, but before we do that, I want to ask you guys a question. Let us know, how would you describe the results you are seeing after your study session? So when you're studying, how are you feeling about the results you're seeing once you're studying? I am seeing great results and I'm happy. The results do not match my efforts. I'm plateauing, or I'm spending too much time and falling behind. We'll give you guys a few seconds to respond. I see the responses coming in. All right, let's see what you guys selected. So it looks pretty even. We have some people who are seeing great results and they're happy, but a lot of people, a majority of people are not as happy as they should be, right? The results do not match their efforts. They're plateauing, or I'm spending too much time and falling behind. And if you answered B, C, or D, then you should really consider utilizing the expertise of an RX coach. So what do we do at RX coach? Well, the first thing we do is start off with an assessment. And we use that assessment to get a good baseline of your strengths and weaknesses. And based on that, we come up with a study plan. And that study plan is individualized to you. You know, a lot of people, when they're studying, will say, oh, you know, I read on the internet that this works, or my friend said to do this. Well, your friend probably has different strengths and weaknesses than you. You guys learn in different ways, and you guys apply what you know also in different ways. And so it's important to take that individualized approach, because that cookie cutter approach that works for other people may not necessarily be applicable to you. And so by giving you this personalized study plan and individual approach, we're able to not only make your studying more efficient, but we're able to help you reach your maximum potential, because we work with you on a one-on-one basis to see how you think, how you learn, how you apply, and bridge those knowledge gaps and work on those test-taking skills to make sure that you're not leaving anything on the table untested. This is a very important exam. We want you to get the highest score possible. And so we're going to work with you on a one-on-one basis to maximize your potential on tested to help you get that score that you've been dreaming of. It's perfect for students who want to study efficiently, who want to pinpoint weaknesses, who want to enhance test-taking skills, and maximize potential on test day. So if you're interested in utilizing the expertise of an RX coach and maximizing your potential, please visit us at rx-coach.com and schedule a free consultation to discuss the program and how it can benefit you, okay? If you want some general advice, we have that available also at firstaidteam.com, all right? So with that, we're going to go ahead and move on to our third question of the evening. So here we go. And as always, remember, we do have a raffle at the end, and you must be present to win. So make sure you stick around, because we would hate for you to win a prize and not be here to collect it, okay? So with that being said, let's go ahead and move on to our third question. As always, you'll see that the answer choices have been removed, and we will start with the lead-in. What is the mechanism of action of the most appropriate drug for treating this infection? What is the mechanism of action of the most appropriate drug for treating this infection? I'll give you guys a few seconds to let us know in the question box what you believe are the most important clues in the lead-in and how many steps you think this question will require. All right, I see responses coming in. We're going to go ahead now and read that vignette. A 60-year-old man presents to the clinic because of a productive cough and drenching night sweats. He takes high-dose prednisone for glomerular disease. He has lost 10 pounds in 3 months. His temperature is 100.8 Fahrenheit or 38.2 Celsius. Blood pressure, 108/72. Pulse of 90. Respiratory rate of 22, and SpO2 of 90% on 2 liters of oxygen. A CT scan of the chest is obtained and shows abscesses in the lungs. A purified protein derivative or PPD skin test is negative. An acid-fast stain of the patient's sputum is shown. More specific culture analysis rules out mycobacterial infection. I'll give you guys a second to take a look at that image. And now, once again, we will read the lead-in. What is the mechanism of action of the most appropriate drug for treating this infection? So once again, I'm going to give you guys a few seconds to let us know in the question box what you believe are the most important and relevant clues in the vignette. We'll give you guys a few seconds to respond, and then we will highlight those clues for you, and Paulus will walk you through those clues as well as how many steps this question requires. I see some people saying acid fast. Responses are coming in. We'll give you guys a few more seconds here. Some people are jumping right ahead to what they think the diagnosis is, but remember, that's not what I asked, and that's not what this question is asking. So oftentimes students will jump right away to the diagnosis and not have the organized thought process, and that can cause them to miss easy points because they're getting disorganized or getting distracted. So try not to do that. Paulus, go ahead.
Thank you, Sean. So we'll go ahead and take a look at what we thought were the important clues in this question. So again, demographic, 60-year-old man. Signs and symptoms, productive cough and drenching night sweats. Other things, anytime they give you any clues about medications, always make sure you're taking note of that. In this case, high-dose prednisone. Another thing, 10-pound weight loss in 3 months. Anytime you see weight loss, especially if it sounds unintentional, that is something to highlight or make note of. We also know that he is febrile, that he has a low oxygen saturation, even with supplemental oxygen. They told us that the CT scan found abscesses in the lung, which is going to be important. They told us that a PPD skin test was negative. And they also gave us an image of an acid-fast stain. Images obviously are always going to be high yield. Lastly, they told us that there was an analysis done that ruled out mycobacterial infection. So when we take a look at this question, I would say this is maybe one of those classic 3-step questions. So we need to figure out what kind of infection this patient has. 2, what would be the most appropriate drug? And 3, what is the mechanism of action of that drug? So knowing this, let's take a look at those answer choices. So again, we'll start at the bottom and we'll work our way up. Answer choice E, inhibits peptidoglycan cross-linking to block bacterial cell wall synthesis. D, inhibition of dihydroopterate synthase. C, binds to the bacterial 30S ribosomal subunit and causes misreading of mRNA. B, binds to the 50S subunit of the bacterial ribosome, inhibiting translation of mRNA. And A, binds ergosterol and forms membrane pores. So once again, we'll give everyone a few seconds to gather your thoughts, and then we'll talk about this question in just a few seconds.
Excellent. I'll go ahead and read those answer choices to you again because some of them were a little lengthy. E, inhibits peptidoglycan cross-linking to block bacterial wall synthesis. D, inhibition of dihydroopterate synthase. C, binds to bacterial 30S ribosomal subunit and causing misreading of mRNA. B, binds to the 50S subunit of the bacterial ribosome, inhibiting translation of mRNA, and A, binds ergosterol and forms membrane pores. We'll give you guys a few seconds here to respond, and then we'll go over the correct answer and the incorrect answers as well. All right, a few more seconds here. All righty. Let's go ahead and see what you guys selected. And it looks like 44% of you guys selected answer choice D, inhibition of dihydroxyapatite synthase. And in second place was E, inhibits peptidoglycan cross-linking to block bacterial cell wall synthesis. Let's take a look at the correct answer. And the correct answer is D, inhibition of dihydroxyapatite synthase. So 44% of you guys got that right. So we've had 43%, 43%, now 44%. You guys are doing pretty well today. So keep up the good work. And with that, I'll hand it off to Paris. Paris.
Thank you, Sean. So let's take a look at that question real quick. So this patient has symptoms and radiographic image that's concerning for pneumonia and lung abscesses. Now, keep in mind, this patient is taking high-dose prednisone, so this patient is considered immunosuppressed, and this could be an opportunistic infection. So the acid-fast staining suggests either Mycobacterium or nocardia infection. However, they told us that the PPD skin test is negative, and additional culture analyses ruled out mycobacterial infection. So this is likely a nocardia infection. So let's take a look at that table that Sean had included that talks about nocardia, but also a common mimicker, actinomyces. So nocardia is gram-positive, and it also forms long branching filaments that can look like fungi. Of note, it is weakly acid-fast positive, and it causes pulmonary infections in immunocompromised patients that can mimic tuberculosis, but with the negative PPD. And you would treat that with sulfonamides, such as TMP-SMX or Bactrim. Versus actinomyces, this is not acid-fast. This causes oral facial abscesses and often associated with dental issues. And that is something you would treat with penicillin. Okay, so now when we're talking about our patient, we've deduced that he has a nocardia infection, so that's why we would give him sulfonamides as listed there, or Bactrim, which inhibit that enzyme listed in answer choice D. Okay, so let's talk about why the other answer choices are incorrect. E, this was the second highly selected answer choice, I believe. So this is getting at penicillin, and that would work in treating an infection such as actinomyces, which also has a branching pattern. However, as we mentioned, it does not stain acid-fast. And again, the presentation would be a little different. That would have more orofacial abscesses, not as much lung issues as we have here. C, that answer choice is getting at something such as aminoglycosides. And that's usually used for the treatment of gram-negative rods, not nocardia. B, that's getting at macrolides, also not used for the treatment of nocardia. And A, this is getting at amphotericin B, which is used for fungal infections. So you can see here how this was a nice three-step question, and knowing each of those steps is what allowed you to select answer choice D. So definitely important to know your pharmacology, your antibiotics, and any images such as this stain, and what would stain in this specific instance, what would stain with acid-fast and what wouldn't.
Excellent. Thank you, Paris. So let's go ahead and move on now to our last question of the evening. As always, we do have a raffle at the end, so make sure you stick around because you must be present to win. Okay? So here we go with our last question of the evening. We've been doing great so far. Let's try to keep the momentum going and finish strong. Once again, the answer choices are covered up, and we will start with the lead-in. Which of the following organisms is most likely responsible for this woman's illness? Which of the following organisms is most likely responsible for this woman's illness? We'll give you guys a few seconds here to let us know how many steps you believe this question will require and what the most important words are in that lead-in. All right, I see the responses coming in. Let's go ahead and read that vignette. A 25-year-old woman says that she has a dry and frequent cough that started 1 week ago. She says that she is coughing frequently and that she has also had headaches and a mild fever during this time. She has never traveled outside the United States. Her immunizations are up to date. She works as a primary school instructor and does not recall being in contact with anyone ill recently. Her temperature is 101.2 Fahrenheit or 38.1 Celsius. Blood pressure is 130/76. Pulse is 101. And respiratory rate is 22. Physical examination is notable only for crackles heard in her right lung base. A chest X-ray is shown below. A sample of her sputum reveals numerous cytoplasmic inclusions, and the sample does not stain with gram stain. I'll give you guys a few more seconds here to take a look at that X-ray of the chest. And now we will read the lead-in again. Which of the following organisms is most likely responsible for this woman's illness? So go ahead and take a second and let us know, what do you believe are the most important clues in this vignette? And then we will have Paras go over the highlights for you. I see a lot of students are asking us, should you highlight things while you're answering questions? And the answer to that is, we recommend doing it because it'll help highlight those clues for you so you can prevent rereading it, but you can also keep track of those clues to keep your thought process organized. Especially in longer vignettes, when you're taking that test, you don't want to have to go back and read the entire vignette. It's better sometimes just to have those clues right there in front of you, okay? So with that, I will go ahead and turn it over to Paras.
Thank you, Sean. So we'll go ahead and take a look at what we thought were the important clues in this question. So again, demographics, a 25-year-old woman, signs and symptoms, dry and frequent cough, and then time frame. When did this start? This started a week ago. She also has headaches and a mild fever, and they gave us a temperature value as well. Again, impertinent negatives or important information. So her immunizations are up to date. She works as a primary school instructor. Other things, they told us that she's a little tachycardic, a little tachypnic, and on physical exam, there were crackles in the right lung. They gave us a chest X-ray image, which we'll talk about. And then they also gave us other important information, that her sputum sample revealed numerous cytoplasmic inclusions, and it does not stain with gram stain. So those are going to be important in this question as well. So when we look at this question, which of the following organisms is most likely responsible? I think this could be a two-step question. I think one, we need to figure out what's going on with this patient, and then two, which specific organism is causing that illness. So let's go ahead and take a look at those answer choices. See if any of those are fitting with what we're thinking. Again, we'll start at the bottom. E, Streptococcus pneumoniae. D, Nocardia asteroides. C, Mycoplasma pneumoniae. B, Chlamydophila pneumoniae. And A, Chlamydia trachomatis. So once again, we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the right answer, and then we'll talk about it in just a few seconds.
Excellent, thank you, Paras. This is our last question of the evening, so let's try to finish strong here. Give you guys a few seconds to respond, and then we'll go over the correct and incorrect answer choices, and of course, conduct our raffle where one of you will win a very valuable prize and access to our resources. We also have a special offer for you guys and a promotion we want to let you guys know about that's currently running. So make sure you stick around. All right, I see the answers are coming in a little bit slowly. That's not a problem. We'll give you guys a few more seconds. All right. We got a couple more seconds here, and then let's go ahead and see what you guys selected. So it looks like 50% of you guys selected answer choice B, which is chlamydia pneumoniae, and in second place was answer choice C, negative alveolar or a mycoplasma pneumonia was supposed to be answer choice C. I guess we have a little bit of a typo here. Our apologies for that. Let's go ahead and take a look and see what the correct answer is. And the correct answer is B, chlamydia pneumoniae. And with that, I'll turn it back over to Pars.
Thank you, Sean. So we'll go ahead and take a look at that question stem. This patient is presenting with a dry cough and fever, and that chest x-ray is showing a consolidation in a single lobe. So this is all suggesting that this patient has pneumonia. However, the inability to grow this bug into sputum culture suggests that it is a chlamydia organism, specifically Chlamydophila pneumoniae. Her sputum sample does not stain with gram stain, which is a characteristic feature of intracellular pathogens such as chlamydia. Chlamydophila pneumoniae is an obligate intracellular bacterium that causes atypical pneumonia. You get a dry, hacking cough, sore throat, and fever. And in contrast to typical pneumonia, the onset's a little bit more insidious, and the patient looks less ill. So when we go back to that table that Sean had included, this is looking over at chlamydia organisms. So as mentioned, these are obligate intracellular organisms that have elementary bodies and reticulate bodies, as we actually had mentioned earlier in one of the questions. So Chlamydophila pneumonia, as you can see there at the bottom, causes an atypical pneumonia, and it's transmitted by aerosol. So that is what I think is important from this question. As mentioned, you could see cytoplasmic inclusions. So we'll go back to our question, and we can see they told us that there is numerous cytoplasmic inclusions in that sputum sample, and it does not stain with a gram stain. Okay, so now let's take a look at some of the other answer choices and why that's incorrect. So E, Streptococcus pneumoniae. This is an encapsulated gram-positive organism. And, we do know that some things about this type of pneumonia, that it can cause rust-colored sputum. It's a little bit more acute. Furthermore, you would see this organism on gram staining. So this is likely incorrect. D, nocardia. This is also a gram-positive aerobe that we actually, just talked about as well, that can also cause pneumonia, especially immunocompromised individuals, but you would not see cytoplasmic inclusions as we saw in this patient. C, mycoplasma pneumonia. Now, it can cause symptoms that are very similar to this, kind of a mild pneumonia where the patients don't seem super sick. However, you would not have cytoplasmic inclusions with that, and so that should automatically rule that out. And then lastly, A, chlamydia trachomatis. As mentioned, this is usually a sexually transmitted disease. It can cause other things such as conjunctivitis and infantile pneumonia. These are also, it's the same chlamydia species, so, it's the same chlamydia. So you would have cytoplasmic inclusions. However, this patient is, well outside that age of what you would consider for infantile pneumonia, where those patients would be at risk for this type of chlamydia trachomatis pneumonia. So the most correct answer in this question is B, Chlamydophila pneumoniae.
Excellent. Thank you, Pars. Great job, everybody. 50% of us got that right. Great job overall today with all of the questions that we did. So congratulations to all of you. For those of you who had a little bit of trouble, don't worry. Hopefully you guys learned from the explanations and we'll get it right on test day. So, earlier today, we talked about sexually transmitted diseases and infections, right? So here's a really wonderful brick. And for those of you who haven't yet experienced RX bricks, I highly encourage you to take a look at some of our free bricks, or even use our trial for RX 360, where you can experience our resources free of charge for a period of time and see if you like it. So each brick here starts off with learning objectives. We have wonderful case connections, which really help bring this material to life so you can relate to them. And then as you are going through this learning module and learning about these different STIs, you'll have images pop up, you'll have little flashcards pop up so you can practice. And as you continue to learn, you will eventually get to the end where you will see a wonderful summary of what the take-home points are. Then you'll have practice questions where you can select an answer choice, and once you select the correct answer, you'll get an explanation of why it's correct. And one of my favorite parts, so then you'll be able to review your learning objectives, mark off which ones you're confident in. And this is my favorite part about bricks. And the reason for that is because, in medical school, if I ask you guys how many resources you have, I'm sure you guys have used several resources. And sometimes it stays very difficult to stay organized, and you're flipping back and forth between things, and you're studying one subject, now you're going everywhere to find that information. But with RX bricks, everything is right there. So if you want to go deeper, you click on this and it'll take you to the electronic version of first aid. If you click on flashbacks, it'll take you to our flashcard system where you can use spaced repetition to study that material. If you need further explanations, in addition to the brick, you can watch an express video, and we have those linked here right as well. And then if you want to practice with board style questions, you can go into our QMax question bank and practice with those practice questions. So it helps you stay organized, and it helps you really learn this material and practice it at the same time, all in one platform. So if you guys haven't taken a look at bricks, I highly encourage you to take a look. As always, we do encourage you guys to stay connected with us. And before I get to that slide, I do want to go ahead and provide you guys with the question IDs for the questions we did today. So if you have access to QMax, you can simply type these numbers, these question IDs into the search field, the RX search field, and review these questions as well. So I'll give you guys a few seconds here to either take a picture or a screenshot or write these QIDs down, okay?